In terms of equipment, you have different ways to remember it. So remember that you need equipment to warm, including preheated warmer, warm towels or blankets, temperature sensor, hat, plastic bag or plastic wrap for babies less than 32 weeks, thermal mattress for babies less than 32 weeks. And don't forget, the OR or labor room temperature should be adjusted beforehand. If you anticipate a preterm delivery, it should be at least 24 degrees. Clear the airway, you need bulb syringe, suction catheter, larger size preferably, and the wall section set at 80 to 100 millimeter mercury. A tracheal aspirator in case meconium stain liquor with an airway obstruction is noted. We need a stethoscope for auscultation. For ventilation, we need the flow meter set to 10 liters, oxygen blender set to 21%, PPV device, which we will discuss later, preterm sized mask and term sized masks, orogastric tube for emptying the stomach with the 20 ml syringe, laryngeal mask, a 5 ml syringe if needed for inflation. This depends on the model of the LMA you are using. Orogastric tube if insertion port is present in case you are planning to do salsa for surfactant through the laryngeal mask, cardiac monitor and leads as well. In terms of oxygenation, equipment to give free flow oxygen, pulse oximeter with sensor and cover, and target oxygen saturation table. So this is obviously usually attached to the warmer, the target oxygen saturation table, and keep the oxygen levels as you need according to the gestation of the baby. For intubation, you need laryngoscope with appropriate size blades. So size 0 for preterm, size 1 for term, and if you have extreme preterm, size 00. A stillet is optional according to the experience of the user. Endotracheal tubes of the appropriate size, so 2.53 and 3.5. Two size tubes are very difficult to get, and most of the time we need to change them once you go to the unit because very difficult to suction and also secure them. So always try to get a 2.5 even in the smallest babies unless it's very difficult. A carbon dioxide detector can be used. Measuring tape or AET tape insertion depth table. So the measuring tape is for measuring the nose tragus length. The waterproof tape or tape securing device and scissors. In terms of medication, we need to have access to epinephrine. If you don't have 1 in 10,000, you need to keep it diluted in advance because you don't want to waste time. Normal saline, preferably pre-filled syringes. Supplies for placing emergency UVC and administering medication. You should also make sure that your crash cart has intraosseous needle for babies. And the table of the calculated drug dosages is